Neonatal reflexes, also known as primitive reflexes, are automatic responses exhibited by newborns in response to specific stimuli. These reflexes are critical indicators of the development and function of the newborn's nervous system. They are observed in the neonatal period, which is from birth to 28 days, and usually fade as the baby grows and the central nervous system matures. In the context of obstetrics, these reflexes are used to assess the neurological health and developmental status of the newborn. Moro reflex, also known as the startle reflex. Moro reflex, or the startle reflex. The stimulus for this reflex is a sudden movement or a loud noise. The response involves the baby extending the arms and legs, then quickly bringing them back towards the body, often accompanied by crying. This reflex is present from birth and typically disappears by 4 to 6 months. The significance of this reflex is that its absence or asymmetry may indicate brain injury or birth trauma. The rooting reflex. The stimulus for this reflex is stroking the baby's cheek or the corner of the mouth. In response, the baby turns the head toward the stimulus and opens the mouth, preparing to suckle. This reflex is present at birth and typically fades by around 4 months. Its significance lies in helping the baby find the nipple for feeding. The sucking reflex. The stimulus for this reflex is touching the roof of the baby's mouth. In response, the baby starts sucking. This reflex is present at birth and becomes voluntary by about 4 months. It's essential for feeding, and its absence may indicate a neurological impairment. The palmar grasp reflex. The palmar grasp reflex. The stimulus here is pressing a finger or object into the baby's palm. In response, the baby grasps the object firmly. This reflex is present from birth and typically disappears by 4 to 6 months. Now, if this reflex persists beyond that, it may indicate a neurological delay. The plantar grasp reflex. The stimulus involves stroking the sole of the foot. The response you'll observe is the toes curling downward. This reflex is present from birth and usually disappears by 9 to 12 months. This reflex helps prepare the baby for walking. The tonic neck reflex, also known as the fencing reflex. The stimulus here is turning the baby's head to one side while they are lying down. The response is that the arm on the side the baby is facing extends, while the opposite arm flexes. This reflex is present at birth and typically fades by 5 to 7 months. It indicates normal motor development. Babinski reflex. Babinski reflex. The stimulus involves stroking the sole of the foot from heel to toe. The response is that the big toe extends upward and the other toes fan out. This reflex is present at birth and usually disappears by 12 months. Significant because persistence beyond 12 months may indicate a neurological issue. Step reflex, also known as the walking reflex. The stimulus here is holding the baby upright with feet touching a surface. In response, the baby makes stepping motions. This reflex is present from birth and typically disappears by 2 months. Its significance lies in demonstrating the innate walking motion. The gallant reflex is observed when you stroke one side of the baby's back along the spine. In response, the baby curves their body toward the stimulated side. This reflex is present at birth and typically fades by 6 months. It is significant because it helps assess spinal cord function. Neurological assessments using these reflexes are crucial. They help in evaluating the integrity of both the central and peripheral nervous systems in neonates. Again, neurological assessments using these reflexes are vital. They provide insights into the health and function of the central and peripheral nervous systems in newborns. Detecting developmental issues is, well, crucial. Absent, exaggerated, or asymmetrical reflexes may indicate birth injuries, neurological disorders, or delayed development. Monitoring premature infants. Reflexes may be weak or absent in preterm infants but develop as the baby matures. Baseline for growth. Reflexes are used as milestones to ensure normal development during follow-up pediatric visits. Neonatal reflexes are essential tools in obstetrics and pediatrics for evaluating the health of a newborn's nervous system. Neonatal reflexes are essential tools in obstetrics and pediatrics for evaluating the health of a newborn's nervous system. Their presence, strength, and duration provide valuable insights into the baby's neurological and developmental status. Persistent or absent reflexes may indicate underlying conditions that require further investigation or intervention.